Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Sinuses and their radiological views. So, first is the Waters view. So, the Waters view is also known as the occipito-mental view or the nose-chin position. So, occipito-mental. So, it is nothing but the occipito-mental view, or it is known as a nose-chin NC view position. Now the position is the nose chin of the patient touches the film. So the nose and the chin, it touches the film, while the X-ray beam is projected from behind. So X-ray beam is projected from behind. So what are the structures seen in terms of Waters view? So mainly Waters view, if you invert it, it will look like a name. So this is maxillary sinus. So Waters view is with maxillary sinus. So maxillary sinus is very best seen in terms of the Waters view. Then comes the frontal sinus. So there is also the frontal sinus. So there is maxillary sinus, there is frontal sinus. Then comes the sphenoidal sinus. So the sphenoidal sinus. Sphenoidal sinus is the film is taken with the open mouth. So sphenoidal sinus in case it is taken with open mouth. Then comes the presence of zygoma, zygomatic arch. So zygoma. Then the zygomatic arch. Next is the nasal bone and the frontal process of the maxilla. So nasal bone, the frontal process of maxilla, as well as the superior orbital fissure, that is SOF, and the intratemporal fossa. Intratemporal fossa. Next we look at the Cardwell's view. So here in the Cardwell's view, it is nothing but the occipito-frontal view. It is the occipito-frontal. So it is nothing but the occipito-frontal view or the nose-forehead position or the nose-forehead position. So the position is, there is a nose and forehead will touch the film. So nose and the forehead, this will touch the film, and it is projected at 15 to 20 degrees. So the beam is projected 15 to 20 degrees caudally. So that is the caudal view. So if you are taking this as a skull, the angle here will be 15 to 20 degree. Next we move on to here, what are the structures seen in the Cardwell's view? So Cardwell's view will be the frontal sinus. The frontal sinus is most commonly seen and it is seen best. Then come the ethmoidal sinus, then the maxillary sinus and the frontal process of the zygoma as well as the zygomatic process, then the frontal bone, the superior margin and the orbit, the superior margin of the orbit. Next is the foramen rotundum. The foramen rotundum. So foramen rotundum is inferolateral to the superior orbital fissure. It is IL inferolateral to the superior orbital fissure, that is the SOF. Next, what do we have? Next is we look at the submento vertical. So submento vertical. So submento vertical or the basal view. So here the vertex is near the film and the X-ray beam is projected at right angles to the film. So the vertex is near the film and the X-ray beam is projected at right angles to the film. So assuming this is the skull, the X-ray beam is projected 90 degrees, that is right angle, to the submental area. So now let's look at the structures which are seen. So the structures which are seen include, there is sphenoidal, there is posterior ethmoidal, then comes the maxillary sinus. So there is a sphenoidal, there is posterior ethmoidal as well as the maxillary sinus. So it is seen best in that order. So it is seen best in this order, that is, first is the sphenoid, then comes the posterior ethmoid and the maxillary sinus. Next, other things is the zygoma as well as zygomatic arch, then the mandible. So mandible is along with the coronoid and the condyloid coronoid. So coronoid as well as a condyloid process. Next we look at the right and the left oblique views. So right and the left oblique views. So what are seen in this? The posterior ethmoidal sinus is seen. So posterior ethmoidal sinus, this is seen, and also the optic foramen of the corresponding side as well as the optic foramen, and this is of the corresponding side. Lastly, we look at the lateral view. Lateral view, the lateral side of the skull lies against the film. So lateral part will be along the film, X-ray film, and the beam is projected perpendicular to the other side. Beam is projected perpendicular to other side. So what are the structures seen in terms of the lateral view? So structures seen here includes the anterior as well as the posterior, the extent of the sphenoid, then comes the frontal, then the maxillary sinus. Next is, it includes the sella turcica, then comes the ethmoidal sinus, alveolar process, as well as the condyle and the neck of the mandible. So this condyle as well as neck of the mandible. To learn and grow daily like this, please do subscribe.